Hi, welcome to Fix My Fibro, and my name's Bernadette. So, one of the symptoms that doesn't ever get mentioned in fibromyalgia, but I think most of you will have suffered it and would know it well, is that when you get dressed in the morning, you put your clothes on, off you go out in your day. As the day goes on, because you are putting on fluid without realizing it, because you're having edema attacks on a daily basis, what happens is by the end of the day, your bra, for instance, is so restrictive that you can barely breathe. And it's actually painful. Like, it's actually restricting blood flow then to your back, because what you put on in the morning, the clothes that you put on in the morning fit you. But then because you're having this massive edema attack, you end up by the end of the day being in agony. Now, I've had so many of those attacks, I can't even tell you. What frustrates me is that no matter how many times I've mentioned it to a doctor, they never acknowledge it. You're not even treated for it. And it's probably why fibromyalgia isn't even acknowledged or looked at as an edema-based illness in part of its presentation. So I have had to leave functions where I've paid $200 to go to an event in the city, an arts event. And in the intermission, I've gone home in tears, crying because of the restrictive forces and the amount of pain from these edema attacks, that by the time I walked to my car and whipped my bra off in the privacy of my car and then started driving, I cried the whole way home because I was in agony and it ruined my night. Now, these things happen quite regularly and it's just not recognised. So these edema attacks is a primary thing that is going on in fibromyalgia. It's not recognised. We don't get any treatment for it. And it's set off predominantly by dietary issues. And we actually get edema from two food chemicals. One is histamines in foods. So high histamine foods, if you look that up on the internet, try and avoid them. And you'll probably know if you then eat them, once you've avoided them for a week or two, then when you go and have one of those items, you will see the edema come on straight away within hours. So the histamines is one edema. And then in some of us, I'm not saying all of us, but in some fibromyalgics have what's known as salicylate sensitivity. And salicylates are a chemical that's in a lot of plants and in a lot of skincare products, actually. It's put in as a preservative. In skincare products, it's the preservative that's put in all fizzy drinks. Sodium benzoate is a salicylate that causes symptoms. Anything called benzyl salicylate, different salicylate chemicals that are put into face care products will cause massive edema attacks. Once again, most of us don't even get a diagnosis of salicylate sensitivity, and it's that ongoing sort of, I guess, if you're eating histamine foods unwillingly, even something like leftovers, so you can eat a fresh food on one day. The next day, if you leave something in the fridge for a day or 2 days, the histamine level increases. So if you don't know that, of course you're going to eat leftovers. You're constantly dealing with pain and fatigue. You're actually getting a bigger histamine hit with leftovers from the next day or the day after. So it's very important the way your food's prepped, that when you prepare a meal, everything's snap frozen once it's cooked, whatever you're not eating, and then you thaw those out and eat them to minimise the histamine content. So histamine edema and salicylate edema are two very real issues in fibromyalgia, not recognised, not acknowledged by the doctors, not treated, and we all suffer like a living hell that we live in every day because of these symptoms. So have a look at low salicylates, have a look at low histamines. Yes, it's difficult to have to restrict your diet, and eliminate these things, not use skin creams with it. Be careful even, with your shampoos and conditioners. I have taken, it takes me 2 hours to go through a shop, a chemist shop or somewhere that a hair care product shop, to check every single label. And there's usually 1 or 2 products that don't contain benzyl salicylate in shampoos, conditioners, or that contain urea. Urea is actually a chemical. It's not a histamine or a salicylate, but urea in any skincare products will cause you issues with our purine metabolism issues. So you actually have to be so selective about whatever you put on your hair, in your mouth, on your skin, because all of these things are causing us symptoms. And it comes down to the chemistry of these items and the fact that our body can't process them since our disease started.